Inpatient rehabilitation is getting people back to their highest functioning level after they have suffered a life-altering event, like a stroke, a fractured hip, a motor vehicle accident that might have caused, some traumatic brain injury, that sort of thing. Probably our youngest patient has been 16 on up to 93, 95. The typical length of stay is usually 10 to 14 days, depending on what the condition is.
Research has shown that people do much better, and the outcomes are far greater than if they would go to a lower level of care than acute inpatient rehab. The 3 hours of therapy a day really speeds the recovery. It's the higher level of care, it's the intensity of the rehabilitation, it's the 3 hours a day that people will get there.
The key thing is, patients have suffered an event of some kind that has caused them to lose their independence, and our job is to rehabilitate them and get them to regain their function and independence so ultimately they can return home.
It was a mild stroke, but it was a stroke nevertheless, and it affected my balance more than anything else. I kept leaning over to the right side, couldn't stand up straight, couldn't stand at all without help. I came back to St. Francis here to the rehab up on the 6th floor, and they carried me in and I walked out with a cane. 3 weeks later, they were pushing me to the limit all the time, every day, which is exactly what got me out of there in 3 weeks. Yeah. If I halfway mastered something, why, we'd move on to something else, and a little tougher, a little harder. And so it was great.
I think just going through the therapy helps pick people's spirits up. It's that physical touch from another human being that is therapeutic.
I couldn't walk. The shape I went in, again, I couldn't walk. I couldn't bring a spoon to my mouth, but I relearned it at a quicker pace. It was very morale building, and they were just very supportive and encouraging, smiled a lot, and helped me accomplish what I needed to do to get out.
In a smaller unit, you're actually probably going to do better because the people know you better and can help you progress faster.
And I got partway up the stairway, or maybe all the way, I don't know, and I fell backwards and went all the way down, hit my head at the bottom of the stairs. For 6 weeks, I was fine before anything started showing up. Then I started getting headaches, and they were on this side of my head and down here. And they said that I needed to have blood removed from my brain immediately.
We are a 10-bed unit, but we can offer the same services as a larger institution, but we're closer to home. It's very important that our patients have the family support, and so if we can keep patients close to home, they'll have that support, and I think that they recover better.
My wife asked if I could get rehab in Grand Island just as well, so she didn't have to drive so far, and they said yes. So they took me to St. Francis, or she took me to St. Francis.
The therapies every day, 3 hours of therapy a day, in combination with rehab nursing and the support of social services for his emotional needs, getting his family involved for that transition home, ultimately was a huge success.
I couldn't even get out of bed when I first got there. And they worked with me, and I started walking again. And I walked with a walker first, and then they told me get rid of that and see if you can go, and I did. And I got that much better. I went back to Wendy's in 3 weeks, and I was back playing the organ.
Key in all that was Gilbert, however, and his ability and his motivation to get better allowed us to facilitate that for him, and he is a wonderful example of the good things we can do, because he's in his mid-80s and he's able to function like a much younger man.
Really, I love my job because I get to help those people who can't help themselves. And so when I see a patient who previously couldn't walk and now they're back walking and even running at some point, that's very rewarding. When people doubted that they would ever be able to return to work, and we get them there, that brings a smile to my face.
That they gave me my life back, and they could have, they encouraged me to such a degree that I wanted to keep working hard and just get out. And they helped me to fulfill my goals.
I'd say it would match anything anywhere in the state of Nebraska. But I've talked to a lot of people that have been in different places with rehab, and I'm so impressed. I'm an example of what they can do.